Join us as we navigate the complex landscape of rural healthcare. In this episode of Geographical Thinking, we're talking with Tomoko McGaughey, a researcher who is redefining our understanding of rurality and its impact on healthcare access. Together, we'll explore how new models and innovative GIS tools are transforming the way we think about healthcare delivery in rural and remote communities, uncovering the challenges and opportunities that lie ahead. Welcome back to Geographical Thinking. I'm Michelle Brake, and I'll be your guide as we explore ideas, stories, and conversations through the lens of geography. Joining me today is Tomoko McGaughey, PhD student in the Spatial Determinants of Health Lab from the Department of Health Sciences at Carleton University. During her studies, she presented at the Esri User Conference in 2023 and received an Esri GIS scholarship for that work that she presented on. Prior to her PhD studies, she completed a Master's of Public Health from the University of British Columbia. Thank you for joining me today and welcome to Geographical Thinking.
Thank you very much for having me, Michelle. Very excited to talk about my work and present all the exciting things that my lab is doing right now.
Awesome. And I know it's always one of those like, oh, where are we in research? Where can we talk about? How are things going? Phases. So I'm always interested to hear what's going on and then follow up in the future of, hey, where did we go? How did things turn out? Um, I guess so. With that, I'm wondering to get us started, can you tell us a little bit about your research and how it is looking to redefine the concepts of rurality in terms of healthcare accessibility?
Of course, my work is trying to create some kind of index that can be applied using normalized geographical units, a normalized score that is easy to interpret, create groupings to identify urban and rural spaces, that can also be applied for general use and service-specific application. Understanding geographic proximity to service centers and population centers is important to understand one's determinants of health because it's so closely tied to socioeconomic status and health outcomes. But this dimension of our lifestyle is measured in a limited way, mainly because others haven't explored it in a service specific or in a nuanced way that is insightful to one's day-to-day life. And this is something that my supervisor, Paul Peters, and I wanted to explore in a more detailed way so then we could properly consider one's rurality through something like access to a 24-hour emergency department, something that we don't use on a daily in a daily way, but we need in emergency situations for our quality of life.
No, and I think that's really interesting that you bring it up because I personally live in a more rural community and it's not aspects that I think a lot about consciously. Like I've lived in cities like Nashville, a lot of access to a lot of things very quickly. I now live in rural Nova Scotia where sometimes the emergency room down the road closes because we don't have doctors on staff. That schedule is posted beforehand on like a Facebook group. So I'm really invested in finding out more about your work.
Of course, yeah. I grew up in a more urban space. I live in a more urban space now, but I have family members that have lived and grown up in rural spaces, and they express similar things where they don't know if their local ER is going to be open on the weekend, and the weekend is the most common time because that's when people are out having fun and boating or doing the things that makes our lives exciting. But knowing our accessibility to those emergency services is essential to understand or ensuring good quality of life.
Yeah, and I'm wondering what are the limitations of traditional measures of rurality when it comes to understanding something like healthcare access, and how does your model look to address these gaps?
Of course, so traditionally, rurality is based on a combination of population density, some standardization in geographical units, some not so standard. The most traditional or easiest to interpret one is one's postal codes. So many researchers, government policies look at the second digit of a postal code. If it's a zero, the space is considered rural, but that that isn't standardized across all provinces. It's not standardized over time, and it's really just a measure of how Canada Post wants to deliver mail, not a measure of one's actual reality, as neighbors across the street could have vastly different postal codes. Also, these are based on spatial units that aren't standardized in data presentation, and it requires a lot of work to actually interpret the results. Other measures like population centers or statistical classification codes, they utilize population density or service density. But again, these and are categorized in groupings, but these are difficult to interpret because they're so focused on a singular feature of daily life, or are not presented in geographic standard units. The best measure that is currently available is probably the remoteness index, which provides normalized values from 0 to 1 and looks at both population density and driving distance to a number of different service types. What our model is trying to do is we're trying to create a measure of remoteness on a normalized scale using small area commonly used geographical units to make the data as interpretable as possible. We're trying to develop a measurement that's not just the closest service or a number of services, but provide proximity to a specific service using a wide variety of population densities. And then by providing a single service type, we're able to provide nuanced measurements for different types of research.
Okay, it sounds like we're really broadening the approach to helping define rurality rather than just, hey, you live in this space, you're classified as this. Because I'll admit, I didn't know the possibility of like the second digit of your postal code indicating that. Now I'm like, oh, what's my second digit? Okay, so I have a two. Does that mean on like a 0 to 9 scale, I'm a two of rurality? There's a lot of things now I want to go explore that further.
It is confusing. It can be really hard to interpret one's rurality. So that's why we're trying to create a series of different measurements. So then when researchers or policymakers apply these measurements, we're able to get as close to a representation of one's rurality as possible for whatever issue they're addressing, let it be hospital service use, education resources, grocery store accessibility. These are all features of our daily life that, given the current measures of rurality, they may or may not be properly capturing one's lived experience.
Okay. And I'm wondering, where did the idea for this research come from? Was it something that you were previously involved in? I know you mentioned growing up in a more urban setting out in British Columbia. So I'm wondering, where did the idea come from?
Yeah, so I started going down this track of research because in my other research work, I look at high system healthcare users across different typologies in Canada. I look at people's use of healthcare resources and how they differ between urban and rural spaces. For this, I wanted to have some kind of measure or representation of their proximity to medical resources, specifically 24-hour EDs, as that's where our data sample was coming from. And after utilizing it, developing that measure because it didn't exist before, and using it in my research, I realized, well, this may not be adequately representing one's actual accessibility to healthcare resources because you may not be sent to the closest hospital. You may be sent to another one that has more space or the adequate resources to address your needs. But there was no measure out there to capture that. And initially, part of my work was the proximity to the 24-hour emergency departments, which was presented at the Esri user conference. And the feedback that we received there was, this is great, but I don't always go to the closest ED, which really solidified in our minds the need for something a bit more nuanced, something that was all encapsulating, so then we could have a better understanding of one's reality based on this type of service. So I took this feedback, looked into other measures of rurality that are used internationally and found the accessibility remoteness index of Australia, also known as ARIA, that featured measurements of small area population spaces to service centers of differing population sizes. In their explanation, it's under the assumption that different population centers are going to have different services available to them, and by having a aggregated understanding of one's reality in that way, we can have an estimate that, okay, person A may go to location 1, 2, 3, 4 throughout their daily life. And if we get an estimated proximity to these spaces, we can understand their true reality. We took this understanding, applied it to the 24-hour EDs with the hopes of generating a reasonably good understanding of one's accessibility to hospital services for small areas that hasn't been provided in the past.
Yeah, and that's really cool to hear how you're able to take like a global look at what's happening in that space and pull from things. I find we don't do that enough in things like planning for healthcare. We do it to an extent of, oh, what are the technological advancements that other people have, but not like what is the system or what are underlying policy tools that we could pull from more. So it's really interesting to see how that's playing a part in your research. And I'm wondering, you did reference the ARIA model, the Australian Rural Index. What lessons from international practices are you able to incorporate into your research, and what adaptations in particular had to be made to suit the Canadian context of provinces and territories? I know the Australian outback, being fairly remote, may lend itself well to some of what we experience here in the remoteness of Canada, but I'm wondering that province and territory uniqueness, did that play a part?
So when assessing particularly the territories, because they have their own accessibility, there aren't roadways that are always available. There are some spaces are only accessible via air travel, via boat. We looked at other countries that maybe experience similar accessibility issues. Because yes, although the Australian model provides a really good context for the majority of Canada, it doesn't for some of the potentially most underserved communities. So we looked deeper into other areas of rurality measurements, and we actually found one measure of rurality that looked at accessibility to hospital services in Japan. A paper from Kaneko et al. From 2023 developed their own measure of rurality based on the remoteness index from Canada and the ARIA, and they integrated some measures that would serve a Canadian model in the future, such as remote islands, spaces, weather, extreme weather outcomes, and travel types used within a certain space. We're not there yet in this model, as we're working off of preliminary outcomes, but I really hope to integrate this work in the future.
Okay, that's really awesome to hear that there are plans moving forward and that there was another resource to pull from and how they've already pulled from some other models. Um, it's just nice to see everybody helping each other and using each other's research for what it's supposed to. Like, we're supposed to help reinforce each other within the research space. So it's nice to see more of that buildup. Um, but I am wondering, you mentioned that there's some consideration for extreme weather factors. How do factors like extreme weather, transportation options, and land use play a part in the model, understanding that they can range so much across the country, as you mentioned, things like ice roads or plane travel? I can imagine these would be harder to standardize.
For sure. So at the moment, the model doesn't take into consideration these factors because we're still trying to figure out what to include. But we predict in the future when we finalize the model, it would be important for us to consider extreme weather. So in the north, the territories, northern Ontario, northern Quebec, extreme weather, snowfall is a major factor, and that will limit one's ability to access healthcare resources, whether it be they can't drive on the road themselves, the planes that would take them to medical services aren't able to function, so on and so forth. Similarly, uh, if we look at my hometown, Vancouver, in the past there have been freezing rain concerns, there have been extreme wind concerns that have limited one's accessibility to healthcare resources. Or if you go to the Okanagan, extreme heat waves will also limit this. So we're trying to figure out the best way to integrate weather into the model, the similarly to other models. Other models seem to stick to a single factor, but given the geographic variety of Canada, we need to consider all weather potentiality, but it's a challenge. So I'm trying to figure out the best way to do this. For transportation options, as I've mentioned, there's air travel considerations, ice road considerations, boating. We again are trying to figure out how to integrate this. This is probably going to come from working with communities to figure out how they would access these resources and integrating it into a regression model in some way. And finally, something like land use, if a space is considered a city, it's easy to measure how the roads are going to function. But if you are living in a rural space, you might have mixed land use where there's a lot of industry or non-standardized roads that you are trying to traverse to go from point A to point B. So we need to modify the accessibility like as such in a way that it will allow proper representation of how long it actually takes to go to a space.
Yeah, and it's great to hear that there's some element of ground truthing or community first person research coming up, because I'm sure those factors are going to be so different. And not to add more questions of, are you including this in your model? But what about some of those factors, like challenges faced by women or gender diverse individuals in accessing healthcare in rural areas? And how does that rural urban divide affect gender based health outcomes?
Of course, yeah. So we with this model, we are focused on 24-hour emergency departments, but women and gender diverse individuals face their own health issues, accessibility issues, let it be whether the services that they need are in their community space, as well as the education of staff, culture of acceptance, and having their issues be adequately seen and addressed. People might be there to help them, but may not receive the care that they need. To address this issue, I am working with a fellow PhD student in the Health and Wellness Equity Research Lab, Maddie Shepard Perkins, to look into this. She's using GIS to map estimated locations of women's shelters and women health locations through Ontario with the intention of assessing the differences in accessibility between urban and rural spaces using the CARI method to get an estimated understanding as one might live in a rural space, but they will purposely go to a larger city because they know they may have more support there, or they'll go to somewhere local because they have family tying them. We can't pinpoint it to a single space, but we want to garner an average. This has some limited availability of data given we don't know the exact location of services for privacy reasons, but we're trying our best to really show that there is a major gap in these rural spaces to ensure proper resource allocation in the future.
Okay, and it's interesting to hear that there there is going to be that difference of lived experience between where someone chooses to seek out services. And I think it's a really important one to call it, because I know in past research that I've done that looking at youth that are currently unhoused, where they're able to go can severely impact their access to healthcare. So if you have a dog, you may not be able to access certain shelters that may be in a better place for you and able to access the treatment or see the specific doctors you're already seeing. So I'm always interested to hear more about how that side of things plays a part. Um, so I think it's really important. It's great to hear as well that there's collaboration with more students and things, and how large this as a topic seems. I know it branches everybody, it touches everybody's lives. So it is a big idea, but it's interesting to see and hear how big of an idea it is and how much people are looking into it, which I don't know, it gives me hope. What about you?
The more and more I talk about this with other people, other researchers, everyone's excited by it. Everyone wants to be a part of it. They all have come to me with their own areas of research that they want to have uh, measured in based on their research needs, and it's really been taken on with like open arms, and I'm really excited to see that because for me, after doing the first bits of my research, I've been frustrated with our current measures of reality, and now I really see there's hope for the future. Maybe a long-term future, but there is hopes for the future to ensure that everyone's voice is being properly represented in how we measure our spaces.
Yeah, and I know I came across your work through a story map that you had put together and submitted for one of the Esri Canada scholarship competitions, and we'll include that link in the show notes. But that does lead me to the question of how has GIS played a role in your research? And I know, I'm sure spatially it has, but I'm wondering, how does GIS as an industry itself and various technologies played a part?
GIS has really been an essential part to my work so far. It's allowed me to conduct the research, present it, and give a voice to the work I've done rather than it just be a published journal article that sits there and maybe someone will pick it up. It's allowed me to share research with people that have little to no experience, the lay human being, and really bring research to other people's viewpoints. It allowed me to collect the locations of the 24-hour emergency departments by using Survey 123, where it allowed geolocation and really easy to use database compilation. It also allowed me to develop the story map that you mentioned to visualize and present the data in a easy to understand way, easy to flow through way. It allows data to be easily accessed, where in the story map you can click on it, zoom into your own community space and see what routes are available for, and it's presented in a unlimited way. You could have your story map be as long or as short as possible, allows as many figures or maps as you would like. In your typical journal article, you are given a set number of words and figures and diagrams. And although this is sufficient for many fields, like for some of my other research, this is completely fine. But for something that is so visually focused, the story maps have allowed me to present my work in a way that is engaging, has allowed me to present my work in a way that is representative of the actual work rather than a table.
And I think it's really interesting that you called out there the difference between something like a story map being a more visual presentation that's easier for the average person to access and understand just because of the nature of it being laid out versus something like a journal article, which is great. But I know if I'm looking at research that's similar between the two mediums, the thing I typically send people is going to be a story map or some sort of other visual product that they can quickly read, piece together. It's like getting the abstract versus reading the entire article. Great. The abstract gives me an idea of what I'm going to dive into. A story map can give you that idea to want to go further into a topic. So I think that's an important call out, that both are really valid. Both have their place, but that visuals and the ability to integrate and navigate data on your own can provide a much more rich experience. So I think it's great that you're using both.
Absolutely. I think it's going to become a norm for me to develop a story map along with a journal article or whatever infographic I develop. I've done that with the work that led to the CARI project, the closest proximity measurements, where there's a story map available. And now, just last month, a published journal article. When I review the published journal article, I feel like so much of the knowledge and the understanding that we've developed through that research is missing. And I wish I could easily tie it to the story map and say, if you want the full story, go over here. And I hope that methodology like that, or that kind of nuanceness, it becomes an industry standard moving forward.
Yeah, and I'm wondering, how do you envision this research influencing collaborations between different sectors, such as public health or transportation and education?
So I'm hoping to see this methodology and approach be picked up by these different industries. I've had one person come to me and want to apply it to public high school. So I'm working with an undergraduate student at Yasin to develop this model at the moment. We're doing it not just nationally, but also by province, because education is considered a provincial factor along with healthcare resources. So we're actually going to be going back to the CARI, developing province specific measurements as well. So it's this ongoing iterative process. We also are hoping to work with community centers. We've had one researcher come who works in physical activity education ask, can we do this for community centers or places that offer physical activity resources to get a measure of physical activity deserts. So we're looking into this model. I just need to find the time to delve into the data resources, because there are so many different types of physical activity resources out there, and trying to figure out the right ones is important when doing a measure like this. I also hope to work with someone to identify accessibility to legal resources, retail, grocery stores. These are all things that make total sense to me to make a measure for, but I am one person and I need to finish my PhD eventually, or at least that's what my family tells me. If I could do this for the rest of my life and ensure that there is a measurement for every industry, I would, but I need to become an adult eventually.
Hey, I understand there's a time limit. Sometimes the school says it has to be done within 8 to 10-ish years. I understand there's timelines, but I know along with dividing up some of that work, a few episodes ago, we met with a research unit called Peach out of Halifax, Nova Scotia at Dalhousie University that's looking at their own benchmark case study of uh, transportation within rural communities. So it sounds like maybe there's some places to team up and form a super group of rurality research.
Absolutely. We're looking into any opportunity for collaboration. We are happy to work with anyone cross nationally, internationally, because as we've mentioned before, this is drawing from a lot of work from international sources. And rurality is not just a local issue, it is something that all rural spaces internationally are dealing with. And only through proper representation will one's voice be heard and properly addressed. And that is our goal, is to make it so rural communities are not forgotten when decisions are being made.
Mm-hmm. I think that's a really important point. And I think looking more to the future, what do you see as being the next steps in your research? Are you looking at more factors, other dimensions of connectivity, temporal aspects?
Beyond what we've discussed, the integration of weather, integration of road types, we also want to compare the currently available model to the other measures of rurality to ensure that we are in line with how other spaces are measuring rurality. We're not misrepresenting them if we were to do comparative analysis, but to show that this methodology actually works, like that it is properly, it is on par with the other measures of rurality that are currently available. Although we are a university lab, we are producing product that is in line with Statistics Canada. We also want to ensure that this model is working not just for a service specific way, but to develop a generalized model so that we can ensure if didn't want to serve a specific model, they could use this other measure that captures just proximity to population densities, which, depending on what you're researching, could be perfectly valid, but sometimes there is a need for service specific research. I'm also looking to re explore this analysis, re implement it using the information from the 2026 census when it's implemented. This model is based on data points and roads from the 2021 census. And after the 5 year cycle of the census, we want to revisit it and see how things have changed, see how, if rural community accessibility has improved over time, and if not, what health detriments or service detriments does this impose.
Okay, and if people are looking for more information or looking to collaborate or keep up on what happens with that next version of the census in a couple of years, where should people go to connect with you? Any and also any words of wisdom for people looking to learn more about this area of research?
That's a fantastic question. If you're looking to learn more about this area of research, please feel free to reach out to either myself or my research lab. They're in the show notes below. You can also find me on LinkedIn if you want to connect there. If you want to look into some of the research that I've discussed today, the links to the story maps that we've discussed are also featured in the show notes. If you want local community specific questions of this type of work, accessibility, I highly encourage you to reach out to your city. Most major cities or local areas will have a city planner who will most likely utilize GIS in their work, and they may have heard of this work. If they haven't, they may become interested. So please feel free to reach out to your local representatives. If you are a student, someone who is interested in conducting this kind of research and have reached out to us, there's also, if you are a researcher or a student who is interested in conducting this kind of work, I highly encourage you to reach out to representatives in your local community that look at GIS research, accessibility. That is how I got into this kind of work. I paired with a supervisor that was cross appointed between health sciences and geography, and it has changed my life. So if you're interested, it never hurts to ask and reach out, because that is what opens the doors for you.
And I think that's a great place for us to leave off on for hope of the future and of wanting to explore it yourself. So, with that, thank you so much, Tomoko, for joining us today. And that concludes our exploration into the challenges and innovations in rural healthcare. A big thank you again to Tomoko McGaughey for sharing her groundbreaking research and insights into redefining rurality and enhancing healthcare access for remote communities. We hope this conversation has shed light on the importance of equitable healthcare for all. If you're looking for more information about the technical side of GIS, check out the Spatial Report podcast where Mark and Maggie dive into the latest and greatest in the world of GIS. Until next time, keep exploring, keep learning, and keep thinking geographically.